Good day everyone, especially to you sir. In this activity, we will be discussing the different institutions that regulate drug control, how interagency collaboration works, and how each agency performs its respective jurisdiction. As you can see, these are the following agencies or the main institutions that govern the drug control. Namely, we have the Dangerous Drugs Board or the DDB, the Philippine Drug Enforcement Agency or the PDEA, the Interagency Committee on Anti-Illegal Drugs or the ICAD, the Barangay Anti-Drug Abuse Council or the BADAC, the Department of Health, and the Department of Education.
So the first one is the Dangerous Drug Board. The Republic Act number 9165 or the Comprehensive Dangerous Drug Act of 2002 mandates the Dangerous Drug Board to be the policy making and strategy formulating body on drug prevention and control. It shall develop and adopt a comprehensive, integrated, unified and balanced national drug abuse prevention and control strategy. The Dangerous Drug Board is the lead policy-making and strategy formulating body of the Philippine government in the campaign against illegal drugs. Its mandates is to develop and coordinate comprehensive policies, programs, and strategies for drug prevention and control across various sectors. Dangerous Drug Board is responsible for crafting national plans that guide law enforcement, education, health and rehabilitation efforts, ensuring a unified and evidence-based approach to addressing drug abuse. It conducts research, monitors drug trends, and promotes public awareness through education campaigns. Additionally, the Dangerous Drug Board sets standards for rehabilitation centers and works closely with other government agencies, such as Philippine Drug Enforcement Agency or PDEA, to implement and evaluate anti-drug initiatives.
PDEA, the Dangerous Drugs Board or DDB, serves as the policy-making and strategy formulating body for the Philippine government's anti-drug efforts. It coordinates with the Philippine Drug Enforcement Agency or PDEA by setting national policies, issuing guidelines, and overseeing interagency collaboration. PDEA, on the other hand, is the lead implementing agency tasked with enforcing Republic Act 9165 or the Comprehensive Dangerous Drugs Act of 2002, while DDB focuses on prevention, education, and policy. PDEA handles operational enforcement, intelligence, and regulatory control over dangerous drugs and control precursors. In January 2024, the DDB officially transferred its regulatory control system to PDEA, as announced through the Electronic Certificate of Accreditation and Tracking or ECAT system. This transition included the issuance of the certificates of exemption and non-controlled status for products containing dangerous drugs or controlled chemicals. The move aimed to streamline regulatory processes and reinforce PDEA's jurisdiction over enforcement and regulation.
The next one, we have the Interagency Committee on the Anti-Illegal Drugs or the ICAD. Its mandate is to coordinate and integrate all the government efforts in the national anti-drug campaign. According to the implementing rules and regulations of the Executive Order Number 15, Article 1, Section 1, ICAD stands for the Interagency Committee on Anti-Illegal Drugs. It is chaired by the PDEA and is originally composed by 20 member agencies, to wit, the Dangerous Drugs Board, the Department of the Interior and Local Government or the DILG, the Department of Justice, the Department of Health, the Department of Education, the Department of Social Welfare and Development, the Department of Trade and Industry, the Department of Agriculture, the Department of National Defense, the Technical Education and Skills Development Authority or the TESDA, the Philippine Information Agency, the Public Attorney's Office or PAO, the Office of the Solicitor General, the Philippine Coast Guard, the Philippine National Police, the National Bureau of Investigation, the Bureau of Customs, the Bureau of Immigration, Armed Forces of the Philippines, and Anti-Money Laundering Council.
Good day, sir. Now I will discuss the BADAC. The Barangay Anti-Drug Abuse Council, or BADAC, is mandated to coordinate with the various government agency and operate within its barangay jurisdiction to combat illegal drugs and through prevention, enforcement, and rehabilitation efforts. Its mandate is rooted in DDB Regulation Number 3 Series of 2017 and further supported by the DILG DDB Joint Memorandum Circular 2018-01, which outline its functionality and effectiveness. BADAC operates within the jurisdiction of the barangay, the smallest administrative unit in the Philippines. Each barangay is required to establish its own BADAC, which is responsible for implementing anti-drug programs tailored to the needs of its community. This includes monitoring drug-related activities, conducting drug clearing operations, and mobilizing community support for prevention and rehabilitation. BADACs are empowered to identify drug personalities, maintain a watch list, and recommend individuals for intervention or rehabilitation. In terms of interagency coordination, BADAC serves as the link between the barangay and national agencies such as the Philippine Drug Enforcement Agency or the PDEA. Next is the Department of the Interior and Local Government or the DILG, Philippine National Police or PNP, and the Department of Health or DOH. It assists law enforcement in intelligence gathering and supports rehabilitation efforts by the referring drug dependents to appropriate facilities. BADAC also work with local health offices, schools, and civil society organizations to promote drug education and community-based rehabilitation.
DOH, the Republic Act No. 9165, otherwise known as the Comprehensive Dangerous Drug Act of 2002, recognizes the role of the health sector and as such has specified the duties and responsibility of the Department of Health or DOH, including the establishment of residential treatment and rehabilitation centers. Furthermore, the Philippines Anti-Illegal Drugs Strategies or the PADS stated that the drug demand reduction through drug rehabilitation and extensive prevention, education, and awareness programs is one of the two strategies to provide a balanced approach on the drug problem in the country. Currently, the role of the DOH in the drug abuse is prevention, treatment, and rehabilitation is being implemented through several offices such as the Dangerous Drugs Abuse Prevention and Treatment Program, the DDAPTP, Health Facilities and Service Regulatory Bureau, the HFSRB, and the Field Implementation and Coordination Team, which is the PIFICT, the establishment of a bureau which will serve as the focal office of the DOH on drug abuse prevention, treatment, and rehabilitation, as proposed in this bill, with streamline patient program management and health service delivery. Senate of the Philippines in the year 2022 an act strengthening the drug abuse prevention, treatment, and rehabilitation, amending for the purpose of the Republic Act No. 9165 series of number 302. The Department of Health or the DOH is mandated to lead the health-related aspects of drug prevention in the Philippines, focusing on treatment, rehabilitation, and public health education while coordinating with the other agencies to ensure a holistic and integrated approach. In terms of jurisdiction, DOH oversees the establishment, regulation, and accreditation of drug treatment and rehabilitation center nationwide. It ensures that the facilities meet medical and psychological standards for effective care. DOH also develops the clinical protocols, training programs for health professionals, and community-based rehabilitation model to expand access to service and especially in underserved areas. The DOH works closely with the Dangerous Drugs Board or the DDB to align health strategies with national drug policies. It also collaborates with the Philippine Drug Enforcement Agency or the PDEA for data sharing and case referrals, and with the Department of Social Welfare and Development of the DSWD for reintegration programs. Local government units or the LGUs are engaged through DOH regional offices to implement community-based rehabilitation and preventive education campaigns. Moreover, DOH integrates drug prevention into broader public health initiatives such as the Philippine Health Agenda and Universal Care, which is the UHC under Republic Act number 11223, ensuring that substance use disorders are treated as part of the continuum of care. This interagency and multi-sectoral approach allows DOH to address drug issues not just a criminal concern but as a public health challenge, promoting recovery, reducing stigma, and fostering community resilience.
Last is DepEd. The Department of Education is mandated to integrate drug prevention education into the school curriculum and coordinate with other agencies to ensure a holistic, community-based approach to combating drug abuse among the youth. Under DepEd Order No. 30, Series of 2018, which outlines the Preventive Drug Education Program Policy for curriculum and instruction, DepEd is tasked with embedding drug abuse prevention and control into the elementary and secondary curricula of both public and private schools. This is in line with Section 43 of RA 9165 or the Comprehensive Dangerous Drugs Act of 2002, which mandates that drug education be part of formal instruction across all levels. DepEd's authority covers all basic education institutions in the country. It ensures that students receive age-appropriate, values-based instruction on the dangers of drug use, the importance of healthy lifestyles, and the development of life skills to resist peer pressure. DepEd also oversees the training of teachers and schools personnel to effectively deliver drug prevention content and manage drug-related incidents within schools' premises. DepEd collaborates with several national and local agencies to strengthen its drug prevention initiatives. It works closely with the Dangerous Drugs Board to align educational content with national policy and with the Department of Health and Department of Social Welfare and Development for student rehabilitation and psychosocial support. DepEd is also a member of the Interagency Committee on Anti-Illegal Drugs created under Executive Order No. 15, Series of 2017, which facilitates unified planning and implementation of anti-drug programs across sectors. At the local level, DepEd coordinates with barangay anti-drug abuse councils and local government units to implement community-based interventions, conduct awareness campaigns, and refer students and families to appropriate services. Through these partnerships, DepEd ensures that drug prevention is not confined to the classroom but it is reinforced by the broader community and government support systems. The agency mapping exercise has definitively eliminated the complex, multi-sectoral institutional architecture mandated to address the nation's drug problem. The detailed review of the DDB, PDEA, ICAD, BADAC, DOH, and DepEd demonstrates that the national anti-drug campaign is not a singular effort, but a unified and balanced strategy established by Republic Act No. 9165. In summary, this exercise underscores the effective anti-drug governance is contingent upon synergy. Success is achieved through the seamless coordination of policy, operations, interagency management, demand reduction, and local mobilization. This comprehensive framework ensures that all aspects, from high-level planning to street-level intervention, are covered, resulting in a robust, whole-of-nation approach. That concludes our video presentation.